Morning, everyone. Bonjour tout le monde. Ani. My name is France Gélina. I'm the MPP for Nickel Belt. With me today is MPP Robin Lennox from Hamilton Centre, MPP Tom Rakosovich from Humber River Black Creek, MPP Kristen Wong-Tam from Toronto Centre. The four of us have put forward a bill to respect Black people's health. We also have on stage my former colleague, Jill Andrew, who's a huge advocate for Black equity, as well as our speakers for this morning. Our speaker for this morning will be Mrs. Carrie Daniel, who's the Executive Director of the Black Women Institute for Health. We also have Paul Bailey, the Executive Director of Black Health Alliance, Shania Kondu-Gore, I missed it again, physicians with Black Physicians of Ontario, as well as Siobhan Stewart, who will give us a patient's perspective. Healthcare is a fundamental right that should serve all people with dignity and respect. But right now, this is not the case for many Black people. Jill Andrew taught me quite a bit about this issue. We were able to make changes for people living with sickle cell disease, and we tried to get race-based data collection in Ontario. But last fall, when the report called Voices Unheard, Healthcare Barriers in the Lived Experience of Black Women of Canada was published, it confirmed what many healthcare professionals and Black women specifically have known for way too long. Racism in our healthcare system affects not only the quality of care Black people receive, but it affects their health, it affects their lives. Voices Unheard provides undeniable evidence of the urgent need for systemic, race, and gender-based data collection in Ontario as a minimum. We need the data to identify and measure, address health inequity affecting Black communities. To learn more about the report, I would ask the Executive Director, Mrs. Carrie Daniel, to come and talk to us. Mrs. Daniel.
Thank you so much. Before anything else, I want to be very clear that we see this as a non-partisan issue. Healthcare is a human right. Black health is not a political issue. It's a matter of dignity, safety, and survival. We are here today because we believe Ontario has an opportunity and a responsibility to lead. Yesterday, legislation was tabled related to Black health equity, and we want to acknowledge that. And we are encouraged to see movement on this issue. And we sincerely hope that all elected officials, regardless of affiliation, recognize the urgency of this moment and support meaningful action. Over the last year, the Black Women's Institute for Health led Voices Unheard. The first national survey in Canadian history focused specifically on the health experiences and outcomes of Black women and girls. Nearly 2,000 Black women and girls from across the country participated. While the survey was national in scope, the majority of respondents were from Ontario. This is the province with the largest Black population in Canada. That means that Ontario has both an opportunity and a responsibility here. Voices Unheard was created because for too long, Black women in Canada have existed in a dangerous contradiction, overstudied in conversation, but understudied in meaningful, disaggregated data that leads to action. We are often spoken about, but rarely listened to. And what women told us through this survey was deeply alarming. None of these issues are new. What Voices Unheard did was bring these issues, these experiences together collectively in one place through the voices of Black women themselves. It gave language, evidence, and visibility to the realities communities have been carrying for generations. Women told us that they are not being heard, that they are being dismissed. 66%, roughly 2/3, said that. They told us that they are delaying seeking health care because of negative experiences with the healthcare system. 42% of women are delaying seeking care. Women shared experiences of racism during pregnancy and childbirth, of mental health concerns being minimized, of chronic pain not being taken seriously, and of navigating systems that too often make them feel invisible. The data revealed a painful contradiction. The majority of respondents reported having access to a primary healthcare provider, yet despite that access, many still reported experiences of dismissal and disrespect. We heard from women who said that they no longer trust the healthcare system. And we heard from women who said they feel forced to advocate harder for basic care that anyone should have access to. So these are not isolated stories, they're systemic patterns. And that's why we're here today calling for more than just an acknowledgement of the stories. When something is truly a priority, it's legislated. And that's why we are calling for the Black Health Equity Framework that is embedded in law, with measurable outcomes, race-based data collection, transparent public reporting, independent oversight, and real accountability mechanisms tied to health outcomes. Because if we do not measure inequity, we cannot change it. We are calling on all elected officials to take Black health seriously, not only in words, but in action. I will now invite Chennai, the Executive Director of the Black Physicians of Ontario, to speak.
Sorry, my sheet is missing here. Thank you. My name is Chennai Kadungre, and I'm the Executive Director of the Black Physicians Association of Ontario. Leading an organization such as BPAO, we hear from practitioners working across Canada and Ontario who see the realities that this report has brought forward. We see how systemic barriers shape care, how bias influences clinical decision-making, and how Black patients often receive a different standard of care within the same system. We also see the gaps within the profession itself. Black physicians remain underrepresented, often isolated, and continue to face barriers to advancement and leadership. This impacts not only the health care workforce, but the quality of care patients ultimately receive. That is why the Black Health Equity Framework is so important. It must require anti-racism. A framework represents an opportunity to move beyond acknowledgement and into enforceable action to ensure that equity is not treated as aspirational, but as a measurable responsibility within Ontario's healthcare system. It must require anti-racism and equity-grounded training across the healthcare system, not as a checkbox exercise, but as a standard of care. It must strengthen pathways for Black medical learners and physicians, ensuring that the system reflects the communities it serves. It must create structures where concerns can be raised and addressed without fear, and where accountability is built into how care is delivered across Ontario. This is about building a system that is capable of providing equitable care, not just intending to. We have the expertise within this province. What we need is a system that is structured to act on it. I will now invite Paul Bailey, Executive Director of the Black Health Alliance.
Thank you, Chennai. My name is Paul Bailey. I am the Executive Director of the Black Health Alliance. For decades, Black communities in Ontario have been clear about what's needed to improve health outcomes. We have the evidence, we have the community knowledge, and we have the leadership. What has been missing is a structure that ensures follow-through and accountability. A legislated Black Health Equity Framework would change that. It would move us from intention to action. It would require coordination across ministries, healthcare institutions, and community organizations. And it would establish clear targets, transparent reporting, and the collection, the utilization, and importantly, the governance of the collection of sociodemographic data and independent oversight, as was shared before, to ensure that progress is measurable and real. It would also ensure that there is sustained investment in Black-led organizations that are already providing care. They're already building that trust and responding to community needs every day. This is about more than reform. It's about transformation. Ontario has the opportunity to lead, to take the health and well-being of Black communities seriously, and to build a system that is accountable to the people it serves. We are ready to partner in that work, and now is the time to act. I will now pass it on to Siobhan.
Thank you, Paul. My name is Siobhan Stewart, and I am here today not as a healthcare expert or policy leader, but as an everyday Black woman speaking from lived experience. And I want to begin by saying something important. In many ways, I consider myself lucky. I have had access to a physician who listens to me, who advocates for me, and who treats me with dignity and care. My physician is not Black, but they are culturally competent, compassionate, and willing to truly hear me. This has made an enormous difference in my healthcare experience. But I know that not every Black woman gets that. And I also know what it feels like when your voice is not heard. I know what it feels like to walk into healthcare spaces feeling vulnerable, uncertain, and unprotected. To question whether your concerns will be taken seriously. To wonder if you will be dismissed, minimized, or judged before you have even finished speaking. No one should have to enter a healthcare system carrying that fear. When Voices Unheard confirmed, what Voices Unheard confirmed is that these experiences are not isolated. Black women across Ontario are saying the same thing over and over and over again, that they do not feel heard, that they do not feel safe, and that they are exhausted from constantly having to fight to be believed. That takes a toll. It impacts mental health. It impacts trust. It impacts whether we seek care at all. And when people begin avoiding health care because they fear how they will be treated, we have a serious systemic problem. This is why this moment matters. Healthcare should not depend on luck. It should not depend on whether you happen to find the right doctor. And it should not depend on how hard you're willing to fight for basic care.
I want to start by thanking the Black Women's Institute for Health for their leadership and advocacy in bringing the Voices Unheard report forward. For the first time in Canadian history, we heard from nearly 2,000 Black women, girls, and gender-diverse people as they shared their lived experiences across the social determinants of health. What we learned from the Voices Unheard report is a call to action for all of us. In Ontario, we know that there is a long history of medical racism and anti-Black racism in healthcare that unfortunately persists today. We know that anti-Black racism impacts the health experiences, health outcomes, and healthcare for Black Ontarians. The stories that participants shared reveal a pattern where Black women's symptoms are too often dismissed, minimized, or misattributed. Action is needed to prevent this from continuing to happen. There is a clear urgency for health policy changes that recognize and address the unique health challenges facing Black women in Canada. I would like to again thank the Black Women's Institute for Health for bringing forward a list of comprehensive recommendations to improve healthcare for Black Ontarians. This is truly a shining example of what community-driven policy can look like, bringing together rigorous research, lived experience, and community engagement to ensure that we are moving our province forward through meaningful partnership and evidence-based policy. Thank you to everyone who has brought us here today and who has committed to working together to advance health equity in Ontario. Thank you, and our group is now open for questions.
So has there been any discussion with the provincial government about having this framework actually enacted? Do we know if the PCs are at all interested in this?
So I can tell you that the bill has been well received, that discussions have taken part. When the report was first made public last fall, a lot of people became aware of it. A lot of people were surprised and shocked by the data that was shared. So a lot of conversations took place at that time. I can tell you that I feel that there are fertile ground to make steps forward. The bill has 11 sections. How many of the 11s will be picked up, will be moved forward? I don't want to commit on this, but do I expect STEP to take down the path? Yes, absolutely.
I've been looking at some of the recommendations in the Voices Unheard report, and it says to create like a Black Workers Ombudsman office. And I'm just wondering, has the experience with like the Ontario Ombudsman office been just as like negative as some of the other things that this report highlights, or is there no faith in the current ombudsman?
I think that there is systemic racism across all systems. And so when we have what we heard in the report, 1/3 of our healthcare workers are black people. And so Black women, in fact, 1/3. And what we heard in the report over and over again from Black women who are not only accessing healthcare but working in the healthcare system is that there is excruciating burnout. There is anti-Black racism that they are facing from patients, from colleagues across the system. And so having an ombudsman that is specific for Black people who are working in the healthcare system would mean that those issues get addressed in a way that is more understanding to them. So it's not that there are issues with the current office, it's just that these are systemic. Anti-Black racism is a systemic issue. It plays across all of our systems. And so if we have one office that is dedicated to supporting Black workers, that's what we need.
So, I don't know what the likelihood of the PCs actually like passing an opposition bill actually is on this subject, but I'd say there's a good chance that they won't pass this. So if that is what happens, what does that say to you and like to the community you represent?
This is not an issue that is, it's not a new issue. We have been, Black women in particular, Black communities, have been struggling to navigate the healthcare system for decades. We're dying as a result, right? I think I'm hopeful. I know as a community we're hopeful that we're at a moment in time where we can come together to pass a bill of this nature. We know how critical data is. That's not something that's up for debate anymore, and we know how critical disaggregated data is. So we're hopeful. We're doing the process. We're going through the process. We've done the work. We've put together these recommendations. We're here. We're willing to work, and we're hopeful.
And one thing I would just add to that is, like Kiri had mentioned, this is a nonpartisan issue. You know, it might be NDP MPP sort of on this bill, but we just want to see the framework put into action. So, you know, if members of the government side want to take elements of this bill or the entire bill itself and put it under their banner and their name, as long as the outcomes get delivered for the people in the community, that's what's most important to us.
That's all the questions I got.
Thank you so much. Thank you.
Just a quick ask. Was there anybody online?
No, there's no call.
Okay, thank you. Thank you very much. Merci beaucoup. Chemewech. And yeah, good job, everybody.